volume has put together an essential package for cancer interventions, and the majority of them that are included address cancers that contributed to about 2/3 of all of cancer deaths. This includes cancers of the lung, mouth, esophagus, which a lot are caused by tobacco. Also, cancers of the liver due to hepatitis B, stomach, breast cancer, cervical cancer, which is due to the viral HPV, and colon or rectum. Now, these interventions that are included focus on prevention, screening, diagnosis, and treatment and palliative care for cancer. Now, when we're talking about prevention interventions, we're talking about in scaling up the birth dose of hepatitis B immunizations, increasing HPV vaccination, and tobacco control. But what about childhood cancer? Where do we stand for preventing childhood cancer or even screening for it?
So there are, with very rare exceptions, no effective prevention or screening programs for childhood cancer. Frankly, unlike most adult cancers, we really have no idea why the vast majority of cases of childhood cancer occur. So there's really no way to prevent them. And as I said, with very, very rare exceptions, there are no screening programs that have proven effective. So really, if you're talking about controlling childhood cancer, you really are talking about treating childhood cancer as it arises. It's important for listeners to realize that just because we don't know the causes of childhood cancer, that doesn't mean that we haven't done actually a spectacular job in high-income countries of learning how to effectively treat it. Childhood cancers are some of the most curable ones out there.
And obviously screening is really important because obviously without an accurate diagnosis, you can't treat anybody because they're not getting diagnosed. But there's a sort of pathologist and also facilities and equipment that are needed for it in a lot of low and middle income places. Where do you see opportunities to improve this and how?
So in pediatric cancer, like really in all cancer, accurate diagnosis is everything. And that presents a major challenge in many low and middle income countries for a few reasons. First of all, the human expertise may or may not be present. And secondly, the laboratory reagents and consumables necessary to make the diagnosis may also not be present. Um, However, there have been some really interesting and exciting ways that people have gotten around these things. Telepathology has been shown to work in many different settings, and even just having referral and diagnosis networks across a jurisdiction or a country. In Kenya, for example, they've built a diagnosis network specifically for retinoblastoma, which is a type of childhood eye cancer. It's rare, and the diagnosis can be complicated. And so there is a network such that the diagnosis of retinoblastoma is centralized across the country. So the challenges are immense, but many jurisdictions have actually done some really creative thinking to come up with solutions to that challenge.
Now, also palliative care is another important area with regard to cancer. Pain control through opioid administration is a big part of this, but what I learned from reading the volume is that this is largely unavailable in many countries. For example, 66% of the world's population lives in countries that has virtually no consumption of opioids. This is interesting, because we do have access here in the United States. And I want to ask you guys, why is this? And how do we work to improve access to opioid medication for cancer patients around the world?
Well, if I could start, yeah, I mean, we hear about the opioid crisis every day in the United States, but it's a very, very different one than what we're hearing about, than what we know about in poor countries, which you never hear about in the news. And it just makes it even harder, though, because the main reason that opioids, like morphine, it's oral morphine that's really needed in cancer pain. Um, Governments are very concerned about addiction and illicit use of opioids, and it's basically, you know, taken control of the needed opioid morphine availability in these countries. There are groups that have been working for decades really to try to improve the situation. And in some countries, it's slowly improving, but it's one of the most difficult areas really to work on.
Opioids still, even in high-income countries, are a major weapon in our fight against cancer-related pain. And so there is a real danger that already existing stigma against opioids in low middle income countries for any use whatsoever is going to be exacerbated by the current crisis of overprescription for non-cancer related pain that's happening in high-income countries. So that's going to take some really strong efforts from advocates and healthcare practitioners around the world to make sure that those two things aren't conflated, because they're